Kidney failure often develops quietly over time, sometimes stretching across months or even years before anyone realizes there is a problem. Many people do not notice the early symptoms because they can be very subtle or mistaken for something less serious. Yet, catching these early signs is essential because the sooner you act, the better your chances of slowing down or preventing the kidneys from failing completely. Research from institutions like Johns Hopkins University and the National Kidney Foundation shows that many individuals miss these important early warnings, putting them at greater risk for serious complications. In this video, we will discuss the key early sign you should never ignore and reveal some surprising lifestyle changes that can make a real difference in protecting your kidneys. In my experience as a kidney doctor for more than 15 years, I have witnessed how crucial it is to recognize the very first signs of kidney failure. When patients notice these signals early and take the right steps, it often leads to better outcomes and improved quality of life. This first sign is not just a small detail. It is a signal that demands prompt attention to protect your kidney health and overall well-being. Now, let's take a closer look at what exactly this first sign is, why it happens, and why it should never be overlooked. The very first sign of kidney failure usually shows up as changes in how often and urgently you need to urinate. Many people notice that they have to go more frequently, especially during the night. This condition, called nocturia, is not just a minor inconvenience. It signals that the kidneys are struggling to keep fluids balanced in the body. When the kidneys begin to fail, they lose the ability to concentrate urine properly, so extra fluid ends up being pushed out. Have you ever noticed waking up multiple times at night just to use the bathroom? That could be an early sign worth paying attention to. Research from the Mayo Clinic highlights nocturia as one of the most reliable early signs that kidney function is declining. So, it is more than just a normal part of aging. Sometimes people also observe that their urine looks foamy or bubbly. This happens because damaged kidneys start leaking protein into the urine, a condition called proteinuria. Protein in the urine should not be there in healthy kidneys, so its presence is a serious indicator that the filtering units, known as nephrons, are injured. These tiny filters become less effective and allow substances that should be kept in the bloodstream to pass into the urine. If you have ever seen foam on your urine, do not ignore it. It might be your kidneys trying to send a warning signal. What do you think about your urine's appearance? If you have noticed anything unusual, share your thoughts below. The kidney's inability to filter waste properly also causes toxins to build up in the body. This buildup affects the nerves that help control bladder function, which explains why the urgency and frequency increase. Damage to the nephrons decreases the kidney's concentrating ability, meaning more urine is produced, but it is diluted and passes out more easily. This also explains why people with early kidney failure can feel the need to urinate even when they have not drunk much fluid. It is an important sign that the kidneys are no longer managing fluid levels as they should. Have you ever felt this kind of urgent need with little fluid intake? Let me know your experience below. Beyond changes in urination, there are other early symptoms you should watch for. Mild swelling or edema, especially around the ankles or eyes, can occur because the kidneys are not removing excess fluid from the body. Fatigue is also common due to anemia, which happens when the kidneys stop producing enough erythropoietin, a hormone that stimulates red blood cell production. If you find yourself feeling unusually tired for no clear reason, this could be related to declining kidney function. Unexplained weight changes caused by fluid retention might also appear. It is easy to mistake these symptoms for other health issues, but they are often linked to kidney problems. Do you or anyone you know experience unexplained swelling or fatigue? I'd like to hear your thoughts on this. Unfortunately, many people ignore these signs, thinking they are just a part of getting older, or in men, assume it is due to prostate problems. This misunderstanding delays diagnosis and treatment, leading to further damage that might become irreversible. Kidney disease can progress silently until it reaches an advanced stage requiring dialysis or even transplantation. It is critical not to dismiss these symptoms or to blame them on less serious causes. Have you ever delayed seeking medical advice for symptoms that later turned out to be serious? Drop a comment below and share your story. Doctors use certain measurements to track kidney health and confirm if these symptoms indicate kidney failure. A GFR below 60 units is a major warning sign indicating the kidneys are not filtering blood effectively. Another important test measures the albumin to creatinine ratio in urine, where a value above 30 milligrams per gram signals abnormal protein leakage. Regular checkups including these tests can catch kidney problems early, especially in people at higher risk, such as those with diabetes or high blood pressure. Are you keeping up with your kidney health tests? Let me know how often you get tested in the comments. From my many years as a doctor treating kidney disease, I have seen how crucial it is for patients to understand these subtle changes. Educating people about watching for urinary differences can lead to early diagnosis, which often allows for treatments that slow the disease and improve life quality. This experience has taught me that patients who pay close attention to their bodies tend to catch kidney failure at a stage where interventions are most effective. What do you think about your awareness of kidney health? How often do you monitor changes in your body? I would love to hear your thoughts. At home, you can track these signs by keeping a simple log of how often you urinate and the amount each time. Pay attention to the color and texture of your urine daily. If you notice foaming or an unusual color, make a note of it. Also, watch for swelling in your legs, ankles, or around the eyes, and be aware of feelings of unusual tiredness. If these symptoms appear or worsen, it is important to contact your healthcare provider immediately. Are you already keeping track of these details? Share your strategies for monitoring your health below. There are times when kidney issues require immediate medical attention. If you suddenly urinate much less or not at all, if swelling becomes severe or you feel short of breath, or if you experience ongoing nausea or confusion, these are serious signs of fluid overload or toxin buildup in the body. Acting quickly in such situations can be life-saving. Do you know someone who has had to seek emergency care for kidney problems? Tell us about it in the comments. Ignoring early symptoms increases the risk of moving quickly to end-stage renal disease and can also lead to heart and blood vessel problems, which are common in kidney failure patients. Early intervention is crucial because it reduces the chances of these dangerous complications. Studies conducted at the Cleveland Clinic show that detecting kidney disease early and making lifestyle changes combined with medication can slow the progression of kidney failure by up to 50%. What lifestyle changes do you think could help protect your kidneys? I would like to hear your ideas. Certain lifestyle factors worsen early kidney failure signs. High salt intake causes the body to retain more fluid, adding extra strain on the kidneys. Poor blood sugar control, especially in people with diabetes, accelerates damage to the tiny filters inside the kidneys. Also, common medications like non-steroidal anti-inflammatory drugs can stress the kidneys further if taken too often. Being aware of these factors and making adjustments is vital for preserving kidney function. Have you ever changed your diet or medication habits to protect your kidneys? Drop a comment below and tell us about your experience. Understanding the first sign of kidney failure in this depth gives you a strong foundation for early action. Recognizing these symptoms and working closely with your doctor can help protect your kidneys for longer. How confident do you feel about spotting these early warning signs now? I am curious to hear your thoughts on this important topic. Now that we have a clear understanding of the earliest warning sign and why catching it early is so important, let's shift our focus to how everyday habits can make a real difference. What you eat plays a crucial role in kidney health, and making smart food choices can help protect these vital organs from further damage. Up next, We will look closely at the foods that protect your kidneys and how they support kidney function effectively. Before we move forward, I want to hear more about you. Where are you watching from, and what health goal are you focusing on right now? If staying healthier, stronger, and more independent as you age is important to you, think about subscribing and turning on notifications so you never miss useful advice like this. Do you feel this information is helpful for your life? If yes, type the number 1 in the comments so I know to keep making content like this, or 0 if you want me to change the approach. I look forward to reading your thoughts. Now, let's take a closer look at foods that protect your kidneys. Certain vegetables, like broccoli, cauliflower, and cabbage, are excellent for kidney health because they contain antioxidants and fiber but are low in potassium. These cruciferous vegetables help reduce inflammation, which is a key factor in slowing kidney damage. For example, 1 cup of cooked broccoli contains about 55 milligrams of potassium, along with important vitamins such as vitamin K, vitamin C, and folate, all of which support overall kidney function and cellular health. Are you including enough of these vegetables in your diet? Berries like blueberries and strawberries are another powerhouse group loaded with antioxidants, including flavonoids and vitamin C. These antioxidants help lower oxidative stress in the kidneys, which can otherwise speed up damage. Half a cup of blueberries has about 42 calories and provides 7 milligrams of vitamin C plus manganese, both essential for healthy metabolism and immune support. How often do you eat berries? Red bell peppers deserve special mention because they offer a high amount of vitamin A and vitamin C but remain low in potassium. 1 medium red bell pepper has about 152 milligrams of potassium and delivers 190% of the daily value of vitamin C, which is critical for maintaining kidney tissue health and fighting inflammation. Are you aware of the potassium content in your vegetables? It matters especially if kidney function is already compromised. How much should you eat? Aim to get 3 to 4 servings of vegetables daily, focusing on lower potassium options if your kidneys need extra care. Incorporate berries daily, around half a cup fresh or frozen as a snack or part of meals. When you shop, pick fresh or frozen vegetables without added salt or sauces to avoid excess sodium, which can worsen kidney strain. If you buy canned vegetables, rinse them thoroughly to reduce sodium levels. Choosing organic berries when possible helps reduce pesticide exposure, which might affect kidney health over time. Have you checked labels for hidden sodium or phosphate additives in processed foods? These additives can silently increase kidney workload and accelerate damage. Preparing these foods is just as important. Light steaming keeps more nutrients intact compared to boiling, which can leach vitamins into water. A simple recipe to try is steamed broccoli with lemon and olive oil. Steam 1 cup of broccoli, drizzle with 1 teaspoon of olive oil, and squeeze fresh lemon juice over it. This keeps the dish flavorful and nutrient-rich without added salt. Are you willing to try simple recipes like this to support your kidney health? Many people make the mistake of eating high potassium foods, such as bananas or potatoes, without checking with their doctor first, which can cause dangerous imbalances if kidney function is impaired. Another common error is relying on processed health foods that often contain hidden sodium or phosphate additives, worsening kidney stress without people realizing it. Over the many years I have worked with kidney patients, I have seen firsthand how including kidney-friendly foods slows down kidney decline and sometimes even improves lab test results. Food choices are powerful tools that should not be underestimated in managing kidney health. Let me know your thoughts on how you manage your diet or what challenges you face with kidney-friendly foods. Drop a comment below if you want more recipes or specific food advice for kidney support. Keep watching because the final 2 points are incredibly important, and I'm pretty sure one of them is something new to you. Now that we understand how important food choices are, let's turn our attention to habits that matter every day. Next, we will examine hydration habits that support kidney function. Drinking enough water plays a vital role in keeping your kidneys healthy because it helps flush out toxins and reduces the workload on these organs. When the kidneys do not have enough fluid to work with, waste products build up and may cause damage over time. Proper hydration also lowers the risk of kidney stones and urinary infections, which are common problems that can worsen kidney health if left untreated. Have you noticed how your hydration habits affect your energy or overall health? So, how much water should you drink daily? Generally, 2 to 3 liters or 8 to 12 cups of water is recommended unless your doctor advises otherwise. This amount can change based on factors like the climate where you live, how active you are, and any health conditions you might have. For instance, if you exercise a lot or live in a hot place, your fluid needs go up because you lose water through sweat. On the other hand, if you have advanced kidney disease, your doctor might ask you to limit fluids to avoid complications. Do you adjust your water intake depending on your day or season? To stay well hydrated, it is best to spread your water intake evenly throughout the day rather than drinking large amounts all at once. Drinking sugary drinks or beverages high in caffeine can actually cause dehydration, so limiting these is important for kidney health. Including water-rich foods like watermelon and cucumber in your diet can also contribute to hydration and provide essential vitamins and antioxidants that support kidney function. Have you tried adding these foods to your meals as a way to stay hydrated? It is important to remember that drinking too much water can cause problems too. Overhydration can lead to an electrolyte imbalance, which is especially dangerous for people with kidney disease. Symptoms such as headache, nausea, and swelling may indicate that you are drinking more fluids than your body can handle. Listening to your body and following your doctor's advice on fluid intake is crucial. Have you ever experienced symptoms related to drinking too much water? From my experience working with kidney patients over many years, I have seen significant improvements in their health when they adopt consistent hydration routines. Sometimes, these changes alone can delay the need for dialysis or other treatments. Proper hydration is a simple but powerful tool that everyone should use to protect their kidneys. What small changes could you make today to improve your hydration habits? Drop a comment below and share your thoughts or questions on this topic. Now that we have a better understanding of hydration, let's move forward to discuss a gentle exercise approach that benefits kidney health without putting too much strain on your body. Next, we will look into safe exercise for kidney health. Physical activity supports the kidneys in many ways, starting with improving circulation and helping to control blood pressure. Proper blood flow is essential because the kidneys filter the blood, and high blood pressure can damage tiny blood vessels in them, increasing the risk of kidney problems. Exercise also helps maintain a healthy weight, which is crucial because excess weight puts extra strain on the kidneys and can lead to conditions like diabetes that further harm kidney function. Have you noticed how your energy levels change on days when you move more? When choosing activities, it is best to focus on low-impact exercises like walking, swimming, yoga, or Tai Chi. These options reduce stress on your joints and muscles while still offering benefits for your cardiovascular system and overall health. Aim for about 30 minutes of exercise most days of the week, as consistency is key to gaining long-term benefits. If you are new to exercise or have health concerns, it is wise to start slow and build up gradually. What is your favorite low-impact exercise to do regularly? There are important precautions to keep in mind, especially if you have advanced kidney disease. Avoid high-impact activities or heavy weightlifting, as these can be too strenuous and may cause harm. Always stay hydrated during and after exercise because your kidneys need fluids to function properly. Listening to your body is essential. If you feel pain, dizziness, or unusual fatigue, take a break and consult your doctor. Have you ever had to adjust your exercise routine because of how your body felt? In my experience working with kidney patients over the past 15 years, I have seen that gentle and steady movement not only improves overall health, but can also positively affect kidney outcomes. Encouraging patients to make small, manageable changes in their daily activity often leads to better blood pressure control and improved well-being. What changes could you make today to add more movement into your routine? Drop a comment below and share your experience or questions. Before we finish, I want to take a moment to quickly review what we have covered so far. The first warning sign of kidney trouble often appears as changes in urination, especially needing to go more at night or noticing foamy urine, which can mean your kidneys are under stress. We also talked about foods that protect your kidneys, like cruciferous vegetables, berries, and red bell peppers, which provide important nutrients and antioxidants without overloading potassium. Proper hydration is key too, aiming for about 8 to 12 cups of water daily while avoiding drinking too much, which can be harmful. Gentle exercise, such as walking or yoga, supports kidney health by improving circulation and controlling blood pressure. Lastly, managing stress with meditation or deep breathing can also protect your kidney function by reducing harmful hormone levels. Are you already practicing any of these habits? Let me know your experience or questions in the comments below. Staying aware of early signs and making small lifestyle changes can make a big difference, especially when combined with support from your healthcare provider. If you found this video useful, please like, drop a comment, and subscribe. In the next video, we will look at an unexpected factor that could greatly affect your kidney health. You will not want to miss it. What do you think this factor might be? I would love to hear your thoughts.